If I told you there was a group of predators out there targeting your children, you would probably fight back. And if I told you that they were using deceitful tactics to trick them into doing something that they don't want to be doing, you'd really probably take a stand on that. Well, I'm not talking about internet predators, I'm not talking about pedophiles. Instead, I'm talking about the tobacco industry, which uses very deceitful marketing tactics to target your children. As a pediatrician, I felt it was time to take a stand on that because really the tobacco industry is no better than any other type of drug pusher.
As a pulmonologist, I see too many people dying from the end effects of tobacco abuse, the emphysema, the lung cancer. By working at the earlier stages when people are still smoking, if I can get 3 people to quit smoking, I'm saving 1 life, just like I was standing by the bedside doing CPR. And that is a real impact. Therefore, we started the smoking cessation clinics initially, which progressed to the Quit Doc Foundation. We have a 2-pronged approach. One is to work with children, teenagers, and prevent smoking, prevent them from ever picking up the tobacco and becoming addicted. And the second is helping people with smoking cessation.
Tobacco use is the single biggest public health problem in the United States. Tobacco alone accounts for 2/3 of all preventable deaths each year. The 400,000 tobacco users who die each year are replaced by 1 million children and teens between the ages of 12 and 17. Because children are the next generation of tobacco addicts, they are the targets of aggressive marketing campaigns.
85% of new smokers start between the ages of 12 and 17, so the tobacco industry uses several techniques to target that particular group. First and foremost, they spend about $11 billion a year on marketing in convenience stores. This is clearly designed to target teenagers who are the most frequent users of such stores, and it's in the form of free giveaways, 2-for-1 pricing, and other things that make it cheaper for the children to be able to purchase it. The second method is to now flavor the tobacco to really blur the lines between candy and tobacco. You'll see new flavored products in deceptive packaging that looks like mint tins. Sometimes parents can even identify that it's tobacco. And finally, there's been a dramatic increase in the last 20 years in movie smoking. These are actors on screen who smoke that make it look like a more normal adult activity. And the sad reality is then it functions like subliminal advertising for the entire tobacco industry as a group.
Education is crucially important when you're battling a health crisis such as tobacco abuse. It's especially important when you're trying to overcome all the influence of the advertising of big tobacco, especially when you're dealing with adolescents and teenagers who often make impulsive decisions not based on the best decision-making abilities. It's even important in adults who made that initial decision when they were kids and now have to live with those consequences and have those habits and addictions built in.
Teaching people about tobacco's deadly consequences certainly deters some children from using tobacco. However, a new approach is needed to reach the children and teens who ignore those health risks as a result of aggressive tobacco marketing.
Most tobacco education programs really focus on the health consequences of tobacco. We take a completely different approach. Our goal is actually to teach media literacy skills so that kids can analyze the films that they see, the ads that they see, and realize that they're being targeted. Teenagers hate to be told what to do. So if you can demonstrate to them that they're actually being tricked into doing something they don't want to be doing, there's a lot of blowback and you generate a lot of anger in those kids. And I think that helps keep them off tobacco.
I hadn't seen any of the stuff with the candy mimicking cigarettes. I'd never seen anything quite like that. I definitely learned something. It was worth my time, It's just sort of creepy.
Instead of relying on the traditional means of delivering their message, the Quit Docs utilize the new media of the digital age to complement their tobacco awareness programs. Internet message boards, youth-driven media networks, and video blogs all give children and teens a platform to share information and create counter-marketing campaigns.
What we've developed is a system where children and teens can actually view movies and score them based on the smoking content. They can then take those results and post them on the internet for everybody to share. That way you know how much smoking's in a movie, what the targeted message is. We've added a message board so kids can interact and actually discuss what they see in the movies, and that brings it out of the shadows. It makes it a lot less subliminal when children and teens can actually talk about it like that. As a result of some of the programs that we've developed, we've actually gotten grants within the state of Florida to teach these programs in the school systems in several counties through the Florida Department of Health.
We have tremendous feedback from not only teachers and educators, but from the students themselves, who go in expecting this to be a boring lecture about the evils of tobacco, which they think they already know. They come out with a new perspective. They see how big tobacco is trying to influence them, trying to buy their decision making. With this anger from how they're being manipulated, they go and form clubs on their own. We harness that energy so they can educate other students and peers.
Prevention efforts are designed to limit the number of new tobacco addicts. While this will drastically reduce the number of tobacco-related deaths over time, there is also an immediate need to provide effective treatment for current tobacco users. The Quit Docs have also created a network to increase the success rates of patients trying to overcome nicotine addiction.